Good morning. I just want to welcome you to the final day of this fantastic event. Um, my name is Jennifer Marshall. I'm an associate professor in the College of Public Health and a public health systems researcher, and I also serve as director of planning and evaluation and outreach for the Sunshine ERC. We have more fabulous speakers today and also an opportunity in a little bit this morning for you to discuss some of the issues and potential solutions amongst one another. And I also just want to, again, give a big thanks to our organizers and our IT team and to our presenters and all of you who are attending virtually and in person. John Staley is going to introduce our first speaker. And thank you. Welcome.
Thanks, Jennifer. Well, good morning. It's good to see everybody back again. A few people kind of coming in slowly, but again, I'm John Staley. I'm at UNC Chapel Hill and Occupational Safety and Health Education Research Center. And it's my pleasure to introduce here in just a moment Maija. We were recently funded as one of the Total Worker Health Centers for Excellence. There's 10 of those across the U.S. And it really is it's an exciting time to think about a lot of talk about collaboration and with these centers doing this. And we're looking forward to that, working again here across the region with the centers. So Maija Leff is the Associate Director of our Total Worker Health Center. So it's the Carolina Center for Healthy Work Design and Worker Well-Being. Yes, got it right. And she's also a program manager and adjunct instructor in the UNC Gilling School and teaches with the graduate certificate that we have in Total Worker Health. So in her role, she does quite a bit, and including strategic planning, direction, and guiding with the center, as well as those of us that work in the outreach core of the center, keeping us in line. So it's my pleasure to introduce Maija Leff.
Good morning, everyone. Let's see. Appreciate y'all being here. I know it's early. I'm not a morning person, so this means a lot to me to see everyone here. As John said, my name is Maija. I'm the Associate Director for our new Carolina Center for Healthy Work Design and Worker Well-Being, another mouthful alongside NC OSHRC, where I also work as that Program Manager for our Graduate Certificate in Total Worker Health. The Carolina Center is a new center. We were funded, we're in our, second year of funding now. And at the end of our first year, we were able to put together this Southeastern Summit for Healthy Work Design and Worker Well-Being. We really wanted to understand what different stakeholders in our region thought the needs were around total worker health. So we brought this together at the end of December. And today I want to share with you all what we learned, what we heard from our stakeholders. And then actually towards the end of this talk, I have a few polls for you all because we also want to hear what you think the needs are around total worker health in our region. It's just an overview. I'm going to introduce the Carolina Center since we are new, and I know that many of you all may not be familiar with the work that we've started doing. Then talk a little bit about why we held this summit. Go through our key summit takeaways, and then get your help after you've had some coffee in refining our list of total worker health priorities for the Southeast region. All right, a little bit about our center. So as John mentioned, we are one of the 10 centers of excellence for total worker health. You can see on the map where those different centers are. And note that right now we're the only one in the Southeast, and so it's part of our kind of mandate and mission to be networking and kind of building a community of practice in the Southeast for total worker health. And we really want to be working with all of you as we move forward. Our aims, of course, to conduct a broad range of multidisciplinary research projects that address safety, health, and well-being of a diverse group of workers. We're especially focused on essential workers. We also need to create a supportive center structure to support our researchers, our pilot projects, and our affiliates. We, through our outreach core, are mobilizing resources and developing partnerships. Right now, we're really focused in North Carolina since we're new, but again, we are going to be expanding throughout the region. and establish our outreach and education activities. I'm sure you all have heard the definition of total worker health at some point, and in the past 15 years is about how long this has been kind of a concept that NIOSH has been moving forward with. But just as a reminder, when we talk about total worker health, we're talking about policies, programs, and practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. So we're looking at both hazard reduction, hazard protection, hazard elimination, but then also thinking about how can the worker leave the workplace healthier than when they arrived, and kind of promote their overall well-being. For our center, this is the conceptual model that we use. This is the model that the Harvard Total Worker Health Center created. This is what we work with all of our students and also our research projects. And just want to kind of walk you all through this because it's so important to how we think about the work that we do. Of course, you see in this inner circle here, it's all about the workers. So we're looking at safety, health, and well-being outcomes for a variety of workers. This can be anything from injury and illness, well-being and mental health, health and safety behaviors, and then kind of more broadly speaking, their family and community experiences. Moving one ring out, of course, everything that's happening with the worker is coming through the conditions of work. So we're really focused on understanding, what is happening in the workplace that is impacting worker outcomes. Conditions of work can span from, our traditional physical hazards, chemical hazards, radiological, et cetera, but also things like work organization, shift arrangement, psychosocial environment at the workplace, and job design. Those conditions of work are determined by the policies, practices, and programs of the business. And then kind of moving one more ring out, we know that all of this stuff is not happening in a vacuum. So everything that a business decides is happening within kind of employment and labor patterns in the region. Of course, what we're seeing now, with folks, this kind of low unemployment rate, that impacts the choices that businesses make. We can also be thinking about things like unionization rates in a state or region and how that impacts the choices that businesses and workers make. And then we can go one more ring out and think about kind of the whole environment that we're in, our social, political, and economic environment. And this is where we're thinking about factors like what is the regulatory environment, in the state or at a national level? What are the social expectations around, for example, mothers working in a given setting? What is the economic environment? Are we in a recession? What's going on and how does that impact the choices that businesses and workers make? Ultimately, this model also looks at enterprise outcomes. So, everything turnover, retention, productivity, how that's impacted by what's going on with the workers themselves. And the model also accounts for, the workers, what the workers are bringing to the workplace. So what are their demographics? What are their skills? What is their union status? It's a pretty comprehensive model, and it's something that's been really helpful to us as we work with our students and design our research projects. I highly recommend reading the Harvard Center's work on this if you are interested in incorporating it. Here's just a quick overview of our center. So Lori Lenan and I are in center leadership. Lori Lenan is the PI for the center. We also have, as you can see there, close relationships with our Injury Prevention and Research Center and with our Center for Health Promotion and Disease Prevention, our PRC, as well as, of course, NC-OSHRC, our ERC. We have an evaluation and planning core that involves some outside evaluators. We have an outreach core that I work with John and Alice Ammerman on. And then we have a few research projects as well as a pilot project program that I'll tell you all a little bit more about. So our research projects, if you got a chance to meet Eric Ryan yesterday, he is the PI for the Total Worker Health Approach to Reduce Falls and Advance Fall Protection in Firefighters. We also have a research project on clinician well-being in response to the pandemic. And they're looking at ways to kind of change the work structure in order to improve clinician well-being. Our pilot projects, right now we have 3. Lena Nylander-French is one of the project leads for our pilot projects, along with Dr. Sean Knipe. And you can see right now we have a wide range of projects. We've got supervisor support and psychosocial safety in the workplace. We have a more kind of conceptual project looking at integrating total worker health elements into a conceptual model for opioid misuse. And our newest pilot project is job stress among construction workers, looking at differences by gender. Something that I also want to call to y'all's attention is that we have affiliate program. This is new. We're about to kind of formally announce our affiliate program, but we do have some affiliates right now. So as I was saying, we're trying to create this network in the Southeast, and we're trying to kind of bring folks together from across different disciplines to exchange ideas around protecting worker health and well-being. And so right now we have 3 affiliate projects that once our website is up, you should definitely check out. They're all very interesting, looking at food access in blue-collar work sites, looking at supervisor support for women returning to work with chronic disability, and looking at physician pandemic stress. Our Outreach and Education Corps is what was responsible for hosting the summit, and is also getting together a series of webinars and a newsletter to kind of disseminate information, including would like to be sharing information from our partners throughout the region. We are also starting a new graduate certificate in total worker health, but that is in the works and will be for some time. And so at this moment, I want to call your attention to the existing certificate that will continue. It'll be our academic certificate. We have some students in the room from this certificate. So this is offered through our ERC. It's 3 courses, 9 credits. And it is now, just as of this year, open to working professionals. It's totally remote. So if you are interested in total worker health and learning more, do go to our website, check out what we have to offer. You can apply and take this course as continuing education at this time. Last bit of the Carolina Center that I want to highlight is we do have a planning and evaluation core that includes our internal team. We have collaborators from RTI and UNC Greensboro who are kind of doing that external evaluation. We have our internal steering committee made up of all of the different wings of our center, and our external advisory committee. All right, so to the summit that we held. Why did we do this? We're a new center. We wanted to be making connections. We wanted to understand what the needs are in our region. So first and foremost, our goal was to convene employers, employees, and other stakeholders in North Carolina and the Southeast to assess needs and interests as it relates to worker safety, health, and well-being. We also wanted and needed to increase awareness about total worker health as a concept, as well as the new center. And then in this summit, we worked together with our stakeholders to identify needs, interests, and priorities in 3 areas. We wanted to talk about research and evaluation, outreach and education, and policy and practice. Here is a list of the kind of folks that we had in attendance. I think this is important to share with you all because we definitely had some gaps, some people that we invited that couldn't make it, some others that we didn't know about. When we get to the end of this talk, would love to hear your input on who else we should invite the next time we do an event like this. But just as a quick overview, we had folks from NIOSH, we had occupational safety and health researchers and practitioners, industrial hygienists, OC-EPI folks, injury prevention researchers, clinicians and clinical researchers, public health researchers, health promotion researchers and practitioners, occupational and industrial psychologists, employment specialists, folks from our business school and economics school. We did have some contacts from our business community in attendance, including an operations manager from a research project that we did during the pandemic, some executive level business practitioners, and graduate students from across the spectrum of the different programs that we work with. I'm looking at this list. I think we're all pleased with the kind of diversity of different disciplines that we had in attendance. What I know that we want to work on in future years is kind of better integration into our business community, getting more folks from local businesses at these summits, as well as more from our state state government. We did have some folks in attendance, but would definitely like more. The structure of the summit, we started with some opening talks. Casey Chosewood, the director of the NIOSH Total Worker Health Program, provided an overview of total worker health, the kind of vision for total worker health in the next 10 years. That talk will be on our website if you would like to see what he had to say. We also had an introduction to the center, much like I just walked through with you all. And then again, we went into these afternoon work groups. This was the meat of the work that we did to identify needs, current efforts, and priorities in outreach and education, research and evaluation, and practice and policy. And here is what we heard from our colleagues. So we'll start with outreach and education. We let folks know, so people came together for about 45 minutes at a time with about, I would say, like 15 to 20 people in a room to brainstorm around these issues. And when we told them to think about outreach and education, we gave them ideas like, this means things like pushing research results out, so making sure that there's a translation from the research that we're all doing into the community and end users. Engaging with key partners to sponsor educational programs, providing training ourselves, continuing education, and also just disseminating accurate safety and health information. So, all the things that we do to put together flyers or, quick YouTube videos to make sure that workers and employers have the information they need to operate safely. Here is what we heard. These are the main themes that we heard from our participants. So one, we need more outreach and education explaining to employers the return on investment or the value on investment of worker health, safety, and well-being initiatives. That came up a lot. We could also think about building a network of champions or change agents in the Southeast. So bringing individuals in to learn about total worker health and then go back to their business or go back to their health department and kind of be an agent of change and kind of have a ripple effect from there. That we have a need for a lot of outreach and education for middle managers in businesses, that these are the folks who are kind of stuck between a rock and a hard place in implementing all of the interventions that we think about, that they often are not given the resources to implement the programs that are mandated from the executive level, and need more support to do so. That we need outreach and education for business executives to kind of make the case for worker health, safety, and well-being initiatives, and this goes back to that concept of ROI and VOI. That we should all be thinking about more innovative ways to disseminate information. We got lots of buzz around social media, thinking about how to get worker influencers to talk about the work that they're doing and kind of get more of a public recognition of the issues that we all face at work. To look for folks who can be the early adopters of total worker health. So we know there are businesses out there who are already have total worker health programs. We know that there are departments out there who already have this, and that part of our work should be to find these individuals, support them so they can continue their work, but then also ask them to mentor other businesses in the region and kind of provide their case studies for others to learn from and be on that leading edge of this new discipline. As I'm sure you've all been hearing, we heard that there's a need for mental health outreach and education for workers at this time. Another really interesting theme that came up is that we need more training for employers on how to reintegrate workers who have been absent from the workplace. So this came up in a couple of different themes. This could be workers who are coming back to the workplace after a period of illness or disability, workers who are coming back to the workplace after an episode of like substance misuse, so thinking about having a recovery-friendly workplace, and also workers who are re-entering the workforce after incarceration. So employers need help knowing how to do this in a way that's supportive to these members of their workforce. I know I heard one of the ERCs was already doing this, training young workers. So a lot of folks commented on how now we have so many jobs, a lot of folks are working kind of part-time or gig jobs, and you can't count that workers will be trained in their workplace so we have to reach them before they get there. So thinking about high school safety, health, and well-being programs that can be integrated into things like career training that high schoolers already have. We heard a suggestion that we need to kind of support more network of exchange of ideas in our region across different disciplines. Again, we are really focused on interdisciplinarity, and so we can kind of be a convener of different individuals and disciplines across the region. At the same time, recognizing that each of our different disciplines has a different lens to approach total worker health. So what an industrial hygienist needs to know to be a total worker health practitioner is different than what I myself as a health promotion practitioner needs to know, and that we need more kind of differentiated or tracked education around this. It's something that is actually not, a lot of the education around total worker health is still pretty kind of 101 or beginner level because this is a newer field, so that we kind of need to move to the next more tracked level. And finally, that we can think about having things like a total worker health certified business to encourage employers that they should adopt this to kind of create a certification process, which I believe one of the other ERCs was also talking about yesterday, to kind of get this certification that you meet standards. Research, so that was all outreach and education. That was our kind of busiest group. People had the most different ideas in there. For research and evaluation, here is what we heard. First of all, when we told folks we're thinking about research, surveillance, data collection in general, program evaluation, and policy evaluation. And the first kind of split of the data was, who do we need to have more research on? And from our particular stakeholders in the room, we heard a lot about we just need more research supporting healthcare workers, caregivers across the spectrum, so folks working in early childhood education, as well as caregivers providing elder care. Precarious workers, so this is our gig workers, contract workers, part-time workers, all the folks who are kind of in this non-traditional employment arrangement. Agricultural workers, and then also workers who are facing structural violence due to who they are outside of the workplace, and how that manifests at work. So, for example, some folks recommended looking into the experience of female construction workers, so kind of facing gender issues, black workers facing racism, immigrant workers, including and especially undocumented workers. So just pointing out there's a need for more of this research to support workers who are vulnerable in this way. Unsurprisingly, we heard that since we need to talk about ROI and VOI to employers, that we need more research around the return on investment of worker health, safety, and well-being programs. That we need more data sharing. So now kind of moving away from research, just like more into our data, that we need more data sharing between different worker health research centers, that we need more data that supports policy change and data that's relevant to policy change. That we need dashboards to make this data more accessible to employers, so visualizing the data that we have. That we need shared databases that we can all be going into across our different centers, and kind of using this data to its maximum. And I apologize, I forgot what the last point is, but you will see it when we get to the poll in just a minute. Practice and policy needs, so our third topic. What falls under practice and policy? So this is just our traditional worker health, safety, and well-being interventions. We were thinking about it, employers having an employee assistance program, that's a program. Having a toolbox training, that's a program. Smoking cessation policy program, so those kind of things. And then policies, we ask folks to think about policies at the org level that your employer may have, as well as policies at the kind of state or federal level, like sick leave policies. And here's what we heard. Oh, sorry. Thank you. Get some water. remember my cute infographics without words. Okay, so our first thing that we heard loud and clear is that we need to engage with workers more in intervention design and in policy design. A lot of folks had negative experiences of being policy implementers in the workplace or program implementers in the workplace. And then just seeing that it didn't land because employees had never been consulted in the creation of these programs, and that just led to program failure. Thank you, John. This theme came back up again, that we need more programs for middle managers, both kind of like turnkey programs that they can implement at the workplace, as well as things to help them just be better supervisors, because that's an important part of total worker health. That we need to find a way to encourage worker organization and empowerment. This is a tricky topic in the Southeast. As you know, we have for very low unionization rates, but also limited other kind of informal worker organization efforts, and so that was really highlighted as something that we need. This came out of a discussion. I don't know if you all saw Oxfam's rankings of places to work, what is like the most and least friendly worker states, and North Carolina fell at the absolute bottom of least worker-friendly states, and one of the reasons was that we have such low unionization and low opportunities for workers to organize and be empowered together. That there is a need for more family-friendly programs and policies and education around that for employers. And that we need to be thinking about issues in the future of work, so programs and policies around like the different work arrangements that we have that we were talking about in the research needs in the last slide, as well as other emerging issues, which we'll be talking about in the next talk. So, we would love to hear from you. You've heard kind of what this group of people, it was a group of about 70 odd people who came together, and these were the ideas that we had, but we would love to hear from you. What do you think? Because we did invite, for example, a lot of our CST colleagues, but many of them were not able to make it. And so this is a community that we would value your input on these same topics as we move forward trying to decide in our strategic plan what to focus on. So here we go. So, starting first, if you have your phone, if you wouldn't mind to go to this poll here. This first question, what type of outreach and education is most needed to advance worker safety, health, and well-being in the Southeast? What you'll see are all of the different topics that I mentioned on that first slide, as well as other. We definitely want to hear if there's something you think our group missed in terms of priority needs. If you just take a minute, you can select up to 5 that you think are the most needed. Go ahead and do that, and then make sure to submit at the bottom, otherwise the data won't come through on our end. So let's take just go ahead and take a minute for folks to do that. those of you who are ready, same thing for research and evaluation. What do we need? What type of research and evaluation is most needed to advance worker safety, health, and well-being in the Southeast? Alright, and then as you're ready, what type of policy and practice is most needed? While folks are filling that out, if the tech team wouldn't mind to pull up the first poll results, the outreach and education one, please. Thank you. Give another minute for folks to finish up the research one. No, sorry, policy and practice, excuse me. All right. So we will share these with you all. It's just a simple poll of what we're all thinking here in this room, and I'm sure it will kind of continue to update as the responses keep coming in. So looking here in this room, our top, oops, thank you. Our top response here in this room, providing training and resources on supporting mental health in the workplace, came out the top, and then we have so that's still a very acute issue after the pandemic. Also seeing there that training and resources that clarify the return on investment or value on investment of worker health, safety, and well-being initiatives. And let's see, after providing, looking, train employers to better engage and support people who are re-entering the workforce. Another high one. Those look like our top three from this group. And then maybe educating youth workers is coming in there in fourth place. Really valuable to know that these are kind of the top of mind issues for you all. Are there any, for folks who answered other, I'm curious, are there any specific topics that you want to shout out to the group that were not mentioned on there? Or it's too early and you're feeling shy, we can share them written afterwards. Any surprises looking at this to you all? Is it anything that you didn't expect to see from this group? Can we please pull up the research and evaluation? Thank you. All right. So coming to the top for us is research on workers facing structural violence due to racism, immigration status, gender, and more was our kind of top interest here. And then agricultural workers. I know there are many folks in this room doing agricultural worker research. And then having databases that we can share between ourselves and translating and visualizing data were the top selections for this group. In the interest of time, I'm going to hustle through this to the last one, but again, we'll share these with you all. Would you please pull up the policy and practice one? All right. At the very top, engaging with workers for design and implementation of programs. This is something that is central to total worker health, but is also central to a lot of the work that we're already doing. And then it looks like in second place, they are implementing family-friendly work policies. Thank you all for participating in this. It is really valuable for us to hear what the priorities were that came to the top for you compared to the group that we worked with. Here are the next steps for us to get this information back out to you. Could we switch back to the PowerPoint, please? Thank you for your help juggling between everything. All right, so we are in the process of creating our executive summary of the summit where you all can see all this data that I just talked with you all about. And I think we will be integrating what we learned today from this activity. If you would like to receive that, you can enter your email to our mailing list. That's the QR code that will take you to do that. For us as a center, we're then moving into strategic planning based on the summit and today's guidance, but I hope that the information we share can be useful to everyone in this room as you're doing your own strategic planning. And then the last thing I want to call to everyone's attention is that, as I mentioned, we are announcing our official affiliate program in the upcoming months. That's an opportunity to partner with our center and have your research kind of promoted through the center and share any resources that you create through our networks, and so we will gladly share information about how to do that. For now, thank you so much for your attention and engagement with this. Our email, if you want to reach out to us, is healthywork@unc.edu. We appreciate our Center of Excellence funding, and just thanks to the whole team for the summit. Thanks, everyone.
All right, we're going to take a quick 5-minute break, quick bathroom, or get a coffee refill, and then we're going to come back. This is a perfect segue into the next activity that Dr. Marshall is going to lead, looking at the emerging issues in occupational safety and health and building on what we did last year if you were here exploring this. So we'll see you in 5 minutes.